Hello, this is Dr. Brian McDonough, and welcome to the Dr. Brian McDonough Show. A very special program today. C. diff, as it's called, is an anaerobic spore-forming bacterial. It's a pathogen. It's all over the world, but it is the leading cause of health-acquired infections and the leading cause of what we call nosocomial antibiotic-associated diarrhea in the United States. It is estimated to cause 500,000 infections and put an estimated $4.7 billion of economic burden on our hospitals and the healthcare system. What does it mean to you? Well, the symptoms with C. diff range from mild to severe diarrhea that goes on and on. It may lead to complications, serious ones in medicine, such as pseudomembranous colitis, a toxic megacolon, a lot of scary things, as well as death. Individuals with the highest susceptibility are elderly, immunocompromised, or have had prior antibiotic usage. Joining me today on the Dr. Brian McDonough Show are two individuals, Mike McIntyre and John Shaffey, who have come up with a way to identify this before it becomes a problem. I welcome them to the program.
Yeah, good morning, Brian. Thanks for having us on your show. Really thrilled to talk to you today, along with Mike McIntyre, our CEO and founder, who invented this groundbreaking technology. So, Michael, your turn.
Mike, tell me about yourself, and we'll get right into the technology and what we're dealing with, too.
Good morning, Brian. Thank you. We figured out something that no one else in the world has ever figured out, which is how to make C. diff visible.
It's a very interesting topic to talk about C. diff because I know in my medical career, I've seen quite a bit of it, and we've dealt with it with patients. Maybe you can explain what C. diff is and why it is such a concern, especially in hospital settings.
Yeah, it's such a great question. About 10 years ago, I was at a conference and I saw an epidemiologist speaking about invisible threats to healthcare. When I heard his presentation, he talked about a wide range of invisible threats to healthcare and the science behind them, the microbiology behind them. But C. diff came to the forefront as the biggest problem in healthcare settings. And C. diff, when it manifests on surfaces, your high-touch areas in hospitals, it's the longest living surface pathogen. It survives for months, even over a year on surfaces, and it wreaks havoc. To give you some perspective, if a patient gets a C. diff infection, every minute in the U.S., in U.S. hospitals, a patient gets a C. diff infection. Every hour, 4 people die from C. diff infections. And there's a very interesting data point we got from University of Virginia, they have one of the world-leading infection preventions MDs in the world, Dr. Amy Mathers. And Dr. Mathers shared with us that patients over the age of 65 who get a C. diff infection die within a year. Now, on the economic side, C. diff wreaks financial havoc for healthcare facilities, specifically hospitals, who get penalized. It equates to close to a $5 billion problem in the United States, $40 billion problem worldwide. So the idea we had was, it was actually a simple idea. I think the best inventions, and this falls into that, are typically pretty simple concepts. And the idea was, how can you get rid of something you can't see? And all of us on the phone, we have sports backgrounds or whatever your background is, but the ability to visualize where a problem is exponentially increases your ability to get rid of the problem and to attack it with pinpoint accuracy. So what we came up with is a tool that has 5 patents issued on it, but it's a spray that's mostly water. It's completely safe, non-toxic, odorless, leaves no residue. But the spray is released with a fine mist on surfaces. It comes in a 10-ounce bottle. That water evaporates on the surface. 98% of it is water, but 2% of it is a proprietary biomolecule. And that biomolecule attaches to these C. diff spores, which have been on surface, again, typically for weeks and months. And a chemical light bulb attaches to the biomolecule. And then with the assistance of a forensic light, in a matter of 2-3 minutes, you're able to visualize exactly where the spores are on the surface. So now, whatever cleaning methodology you have, whatever cleaning protocols the hospitals have, facilities have, nursing homes, et cetera, they can now see where the target is they want to get rid of and apply whatever kill products, disinfectants, methodologies like UV robots they use. And then subsequently, after they apply, verify it's gone. So it's a breakthrough at the highest level. We are, again, the first and only product in history to provide microbiological visualization of any pathogen, let alone C. diff, which is the most robust and longest living surface pathogen.
It seems like such a simple concept, like light something up so we can see it, take care of it. And yet all these years, really nothing was developed like that. What made you interested in this? Like, why would you all of a sudden say, oh, C. diff, let's go after that?
Yeah, that's so interesting. I can't, it's almost like an intangible, or, I can't even describe it. But what hit me with C. diff when I saw this presentation, Brian, is that the epidemiologist was continuing to emphasize the science and microbiology behind it, and the robust nature of C. diff spores on the surfaces, and how C. diff spore has it's like a microscopic M&M with a shell that can't break. And on the outside of that shell, it's called an exosporium, and then you have the exterior coat of the C. diff spore, and they're impenetrable, but they have proteins on them, and they contain these deadly pathogens that are highly contagious. And C. diff infection is one of the worst to get. 80% of patients can get a reoccurrence of C. diff infection. 4 out of 5 are readmitted to hospitals. Here's the economic impact. And I thought, no one's talking about how do you get rid of it? And they talked about different kill products you can use for it. But I said, well, how do you know the kill products are working if you can't see this thing? But we have a breakthrough that is unprecedented in surface surveillance and infection prevention. And our vision, we say this a lot, is our goal is pretty simple. Our mantra is we want to save lives now. And we know that all the data, all the science we have behind this, the logic behind this is even more irrefutable, because if you can make C. diff visible, you have a much greater chance of getting rid of it versus not being able to see it. If you can make C. diff visible and apply whatever kill methods are available in a hospital protocol, you can now verify that you got rid of every speck of C. diff on these high touch surfaces. You're making the environment safer, which again correlates to a greater level of prevention, and higher prevention saves lives and saves money. So again, save lives now. We want to speed adoption, and we're in the process of speaking with a wide range of strategic partners to take this and expand it not all over the U.S., but all over the world. And many of those partners are customers. So like, for instance, we're in the Mayo Clinic about a month ago. They ordered product the same day. They're already implementing it. Texas, we're in 3 largest hospitals in Texas. We accomplished that in about a month. So we have these early signs of going viral that we're really excited about. We're really proud about.
I know from my experience as a practicing physician, decades, that this has been not just a thorn in our sides. It's something that literally is a killer, as you say. So when I heard that there may be something there that could actually make that kind of a difference, I also want to help get the word out, because we have a big medical audience who listen, and they may not know of this. I certainly try to stay up on everything. I didn't know about it. So this is relatively, I know it's your world and you know all about it, but it's kind of fresh for many of us. And I don't think there's a person out there who takes care of patients who doesn't recognize the value of a tool to do this. And it's also important, Mike, I wanted to ask you about, for not necessarily physicians, the nurses and patients, but also people who work in hospitals who are environmental services. These people are at great risk as well, just doing the work of cleaning. And does it make a difference and help there?
Yeah, that's such an important piece of this. So, when any of us go in the hospital, or to whether we're in there or family members in there, every time a patient goes from one room to the next or one department to the next, there's a discharge cleaning process, sanitation process. And that's led by housekeeping / environmental services. And these frontline environmental service people, we're launching a campaign that we're calling the Invisible Heroes. Ties in, obviously, we're making a deadly pathogen, the longest living pathogen, visible. But they are literally hands-on on these high-touch areas where these C. diff spores are wreaking havoc, and they're spreading it spreads the infection rapidly at times. So, but they're very unrecognized. They're kind of low on the totem pole in the hospital, taken for granted. But the team, these environmental service teams, are passionate about their jobs. They really care about making these rooms the highest level of sanitization, the highest level of cleanliness, and as safe as possible for the subsequent patients and for those who are taking care of the patients, the nurses, doctors who are walking in those rooms. So now University of Virginia was interesting. They were one of the first hospitals of major influence to get behind us earlier this year when we launched at the end of last year. And what they did is position this as, we're giving you a tool that's new technology, and we're giving you a tool that enables you to take what you do to another level, not only to protect our patients, not only to protect your colleagues, but to protect you. And we're really proud to have us leading this process. And a really cool story is, they're so excited about it. When John first started with the company, I took him down to University of Virginia in Charlottesville, and they said, hey, we want to show you something. And they walked us into a room, and a dozen people held up these T-shirts. They called them Spore Busters, kind of like a Ghostbusters theme. And John and I both got chills. And it was like, wow, unsolicited. They said, we're so proud to be part of this and part of this initiative and to be leaders in it. That led to them reaching out to one of the largest contract service providers. I'm not going to pitch any company, but the largest healthcare service provider company in the world reached out to us, and they said, we want to partner with you. We want to take you in all of our facilities of influence and spread that out to all of our facilities, all over the world. But they have a contract service provider for half of the U.S. hospital beds, today. And so great partner with us. It's been another accelerator with it, but it's making those frontline workers, recognizing them is really important. And one of the things we're launching with the PR campaign is every month we're going out to giving out an award to environmental service housekeeping teams at different facilities all throughout the country, and just recognizing them as, the invisible heroes, and giving them the recognition they deserve. So we're really proud of that. To not only lead the initiative to be the first and only to provide microbiological visualization, the first and only to make C. diff or any pathogen visible, we want to lead a process to recognize those frontline heroes, the invisible heroes on the front line, who are really making a difference every day. Prevention before the disease spreads is what we're going to do. So we're going to start in all the high-risk areas right away. We're going to make this part of our protocol build and training. C. diff spores are everywhere in these facilities. They're everywhere in the environment. And again, how can you get rid of something you can't see? Well, now you can see it, which gives you a much greater chance of getting rid of it. We have a new website we just released a couple of months ago. It's liveprocess.com, and our contact information is on there. Save lives now, speed adoption.
Mike McIntyre, John Sheffy, I want to thank you both for joining me on the Dr. Brian McDonough Show.
Thank you, Brian.